Welcome back to Basic Physics Part 3. We will go through some of the ultrasound controls used for image optimization now. Let's look at interactions between ultrasound and tissue. Absorption of the ultrasound waves as they pass through tissues is an important interaction. It accounts for up to 80% of attenuation of the ultrasound beam. Absorption happens as the sound waves cause the particles of the tissue to vibrate, generating heat. Energy of the sound waves is changed to heat, causing attenuation of the sound waves. Attenuation is determined by the attenuation coefficient of the tissues and the frequency of the sound wave. Higher frequencies of sound wave are attenuated to a greater degree as they pass through the tissues. Higher frequencies of sound wave have therefore less penetration of the tissues. This is important to realize for imaging of deeper structures. We need to use ultrasound of lower frequencies when imaging deeper tissues. We can increase the power of the output of the ultrasound beam to account for the attenuation that occurs as the ultrasound beam travels through tissues. Increasing the power increases the intensity of the ultrasound beam, leading to better penetration of the tissues. This, however, has the drawback of producing heat, which can cause thermal damage to the tissues. We should increase gain to account for attenuation before increasing the power output. Gain is a form of image post-processing that will not lead to increased heat generation in the tissues. Use the lowest power that is consistent with lowest thermal energy generation in the tissues. Increasing gain has the effect of amplifying the returning echoes. Gain should be adjusted so that blood or fluid-filled spaces appears black without any gray. The drawback of too much of gain is a loss of spatial resolution of the tissues being imaged. The image on the left has the correct amount of gain applied. The image on the right has too much of gain. The fluid-filled spaces appear gray and there is decreased spatial resolution of the tissues. Gain should be adjusted to the minimum required so that there is a complete range from low amplitude dark gray to high amplitude white signals represented on the image obtained. This image has adequate gain with fluid-filled cavities appearing black. We can adjust the overall gain, or more specifically the time gain compensation and lateral gain compensation. Time gain compensation allows for returning echoes from deeper structures to be amplified more when compared to returning echoes from shallower structures. This allows for a more uniform image to be obtained. Time gain compensation is usually set as a slope, so that returning echoes from the deeper structures are amplified more. This is shown as a knee bend in the image. The diagram here shows how the attenuated signals from the deeper structures are amplified to a higher degree when compared to the stronger returning signals from the shallower structures. Here are two examples of TGC or different time gain compensation settings. By altering the TGC, we can amplify returning echoes from the deeper structures which are attenuated. This allows for a more uniform image in terms of gray scale to be obtained. The image on the left has the TGC set to amplify the returning echoes from deeper structures. The inferior LV wall therefore appears brighter on the screen when compared to the image on the right. We can use the same principle for the lateral gain compensation controls. Increasing the gain at the lateral borders of the image allows for image compensation as the echoes returning from the lateral edges are more attenuated due to scatter. Let's now look at the effects of frequency. T-probes have a frequency range from 2 to 7 MHz. Increasing the frequency allows for better image resolution. Penetration of the echoes is, however, reduced. Increasing the frequency reduces the penetration of echoes and compromises imaging of deeper structures. We therefore use echoes of lower frequency when imaging deeper structures, such as when imaging in the deep transgastric view. Three separate modes can be selected from the Philips machine. These are general, penetration and resolution modes. Penetration mode uses lower frequency and allows for imaging of deeper structures. Resolution mode uses higher frequencies and allows images with better resolution to be obtained. General mode is between the two modes. We can see here that the deeper structures are imaged better with the penetration mode, which uses a lower ultrasound frequency. These are more examples of the differences in image quality obtained when imaging with different frequencies. The deeper structures are poorly imaged when higher frequency of ultrasound is used. This is because higher frequencies are attenuated and do not penetrate to the deeper structures. The aortic valve is best seen with the penetration mode in this deep transgastric view, as its location is far away from the TEE probe transducer. In the next mid-esophageal long-axis view clips, we can compare the effects of lower and higher frequency. We can see that the resolution of the image obtained with higher frequencies is much better when compared to the penetration mode, which uses lower frequencies.